Welcome everyone today for this breast cancer awareness session. As we all know, this is the month of October and we are creating a lot of awareness events, and we want everybody to know how breast cancer and its screening and awareness is important, because this is the most common cancer affecting women, and the purpose behind all these awareness sessions and these screening programs is to let the women know that yes, they might not be able to feel anything in the breast, and there might be still changes ongoing already in the breast. So that's why screening is very important when it comes to breast cancer, because screen detected cancers generally do very well, and in terms of prognosis and in terms of survival. So I am Dr. Rabia Khan. I'm a consultant breast surgeon at Mediclinic City Hospital, and today we will talk some general concepts about breast cancer. So, like I said, this is the most common cancers happening in the female, and the second most common cause of cancer death related to in women. The average age in which women get breast cancer is between 40 to 60 years of age. However, we do see women in their 30s and in their late 30s, late 20s, even we have seen cases that it's increasing in incidence as well. Mortality rates have declined over the period of decades because of screening. Like I said, screen detected cancers overall, they do really well in terms of survival and prognosis. So the early detection, better chances of healing and better chances of recovery and better chances of survival as well. So this is showing the incidence. We see that incidence increases with increasing of age because of the long-term exposure to the hormones itself. So we will talk about the risk factors, and then we will see how the hormones are related to that. So yes, incidence also is affected by a difference of race, and we can see that Caucasians are slightly more common to have it. Um, so breast cancer and some normal anatomy. This is very important to know that breast is made up of two different type of tissues. Um, a percentage of breast is made up of fat as well, and as the woman grows, the fat content of the breast is taken up more. It's more fatty as you grow older. And if we can see that there are a component of the breast that is made up of these milk ducts and milk globules, it is there where the cancer can form. So that is why recently the researchers have shown that the more dense breast also increases the chance of breast cancer. So when a breast is considered dense, when it has less amount of fat and more amount of breast tissue, that includes the milk ducts and the milk globules. So, and if you see this area in the corner over here, these are lymph nodes. So if a cancer develops in the breast, it will spread out to the different areas of the body through these lymph nodes. So these lymph nodes are also very important when it comes to breast cancer. So these are some very general concepts how cancers can form. This is a normal duct. When we see there's a nicely lined placed cells, then they start to get abnormal and they stay within the ducts, and we see that these number of cells, they are more. This is called hyperplasia. This is starting to get abnormal. Then we see that still at this point the cells are still normal in shape, and then they start to get abnormal in shape, and then the whole duct is being replaced by abnormal cells. This is a stage when we call the cancer is stage 0, and these stages, it is very difficult for a woman or even a physician to feel it in the breast, and these changes are only detected on screening mammograms. So this is the important when we say and we emphasize on screening mammography. This is the stage when we pick up majority of the cancers on screening. And once the cancer is becoming abnormal and uncontrollable fashion, these cells, they break up these ducts and they are ready to spread over. Then it is automatically now from stage 0, it has become either stage 1, or if sitting in the lymph nodes that we discussed, this is stage 2. If it's already sitting and the woman has never noticed anything in the breast and sitting anywhere else in the body, then it definitely is a stage 4. So this is very important when we talk about the survival benefits. Of course, there's a huge difference if a woman is diagnosed in a stage 4 and to a woman who is being diagnosed on stage 0. So from the breast, the cancer can actually spread most commonly to the lymph nodes, but also to certain other lymph nodes behind our collarbones, above our collarbones, and near our chest bone. The other areas of our body where the cancer likes to go and sit there is our lungs, liver, and the backbone as well. So what causes breast cancer? There's a lot of myths and misconceptions that women have that, okay, maybe wearing an underwired bra, maybe wearing a black bra, maybe putting a deodorant in my armpit. So all these things, they have no medical significance. 90% of the breast cancers, to be honest, we don't find any reason in majority of our women that why this particular woman gets a breast cancer. But yes, genetics is involved, but a lot of environmental factors. Mainly 5 to 10% of the breast cancers are genetically inherited, or if they have a genetic mutation in their blood, in their family history, any genes is involved. That is not a very big number. You see, 5 to 10% of the cancers are only genetically inherited. So the risk factors, okay, increase. I would say all my patients that, okay, why they get breast cancer? Because they are women and this is common for us, and because we have breasts, so we get breast cancers. This is the very common answer to this question if somebody will ask me. But yes, definitely there are certain risk factors that we see. Increasing age, women above 50, yes, they have more chances of having breast cancer as compared to a woman who is 25 years of age. Hormonal factors, early menarche or late menopause. The longer you are exposed to the hormones of your body that's produced by your own ovaries, the more chances of, because a group of breast cancer is hormone driven and hormone influenced. Radiation therapy, if those patients who had radiation therapy in their early adulthood for the treatment of lymphoma, this is somehow increasing the chances of breast cancer in those particular women. But this radiation therapy does not mean that you have a chest x-ray, or if you have a mammogram every year, that is causing increased radiation and that is causing breast cancer. No, that's another myth that we see a lot of time. Women comes and ask and they are scared of doing mammograms that, okay, this is radiation. So we are not talking about that radiation. Radiation therapy is something extremely different, which can be one of the reason of breast cancer. This is kind of a treatment for a certain type of lymphomas. If you have a family history, if you have a first degree relative like your mother, your sister, your maternal aunt, paternal aunt, or your grandmothers, yes, you can have an increased chance of breast cancer. Not necessarily means that it has to be in your genes. No, having a first degree relative with a breast or ovarian cancer can somehow increase your chance of breast cancer as well. Having previous issues with the breast, like having precancerous situations, like certain lesions in the breast that are considered as high risk lesions. So we do treat women who are found to have high risk lesions, but yes, then it increases their chances of having breast cancer. And like I said, dense breast tissue. What is a dense breast? That breast which have less amount of fat and more amount of breast tissue, like milk producing glands and ducts, then it is more chances of having breast cancer. These are the very commonly encountered myths about breast cancers, that deodorant different type of bras, like I said, black bras, underwire bras, deodorants, body sprays. No, not at all. These are just myths about breast cancer. They have no clinical significance. Having an implant done for breast augmentation or to increase the size of your breast for cosmetic reasons does not increases your chances of breast cancer. Yes, 1 in 100,000 women might have a lymphoma, can be associated with a breast implant, but it is an extremely rare type of disease. Induced abortion, size of the breast does not matter. It can happen even in a double D size breast or even in a cup size A. So size does not matter. Birth control pills, oral contraceptive pills, pills that are used to avoid having pregnancy does not have any impact as per the recent publications and a lot of studies. Yes, before it was considered that yes, it is hormones and they can affect, but not the birth control pills. Hormone replacement therapy, yes, we will talk about it later, which the woman takes after menopause to deal with the symptoms of menopause. They are somehow can be related to, but if taken over a period of long time. Mammograms, like I said, yes, mammogram is a kind of X-ray and it does involve radiation, but this is a small amount of radiation. And when it comes to the benefits of the mammograms, these benefits are much more than the risks that of the radiation. So we do advise and recommend every year mammograms. So what are the things that we can do to reduce our risk is being physically active, having a certain type of exercise program, at least 3 to 5 times a week, maintaining an ideal body weight, BMI below 25, drinking less or no alcohol and no smoking as well. Having children at an early age has been shown to be protective in terms of breast cancer. Breastfeeding is a questionable mark. We do see women who have multiple pregnancies and have breastfed all their children for 2 years can still have breast cancer. And on the other hand, women who have never have breastfed and they can also have breast cancer. So we don't emphasize, yes, I mean, breastfeeding is something that women should do and we do encourage because it's healthy for the child and for the mother as well. But to associate it with the breast cancer, it's a bit difficult for us. Hormone replacement therapy, like I said, if you have taken it for a long period of time, yes, because this is exogenous and these are synthetic hormones that you are taking, they can influence and they have an impact on having breast cancer. But yes, on the other hand, if the women at their after their menopause, they are dealing and suffering with the symptoms of menopause, then you have to have a word with your physician. If the benefits of these hormone replacement therapy are more than the risk that they are adding, then yes, you can take these hormone replacement therapies. We can have a discussion with the patient about that, and if the benefits are much more and the woman really needs hormone replacement therapy, yes, it can be taken for a short period of time. That's completely okay. All right, so now let's talk about the signs and symptoms. What can a woman feel and notice in the breast if there is any change that is happening? So most importantly, there can be no change at all. There can be no symptom at all in the breast. That's why screening is important. Some women have huge breasts. They might not be able to feel anything in that breast, which is a double D size of breast. You might not be able to feel a small cancer, which is 1 centimeter growing in the breast. So yes, in a smaller breast, it is easy to feel. And some common symptoms can be pain. We don't necessarily always have pain in breast cancers. Breast pain does not always mean that you have a breast cancer. Breast pain is a very common symptom. Breast pain can happen without any reason. You can have breast pain if you are stressed. You can have breast pain before your period. You can have breast pain if you have simple cysts in your breast, simple lumps in your breast. So it is one of the symptoms that you can see, but not always is associated with breast cancer. If you have noticed all of a sudden without any history of trauma or injury or any insect bite, any skin changes in your breast, if there is any redness on your skin all of a sudden has started, consult a doctor, please. Then if you know that there is a nipple and then the surrounding area which is slightly darker in color, that's called areola. So if you have noticed any changes in the areola, if you have noticed anything that is making scales in the nipple or areola, or there is itching in the nipple or areola, please consult a doctor. If you have noticed all of a sudden there is skin of the breast that has started become thickened like a skin of an orange and have it pits on it, please consult a doctor. That is not normal. Some women are born with inverted nipples, and if you are born with inverted nipples, that is completely normal. You don't have to worry about that. But if you have noticed that your nipple has been pulled inwards or towards a certain direction, that is not a normal sign. You need to see the doctor. Women of childbearing age, they can have normal discharge, which can be milky in color, which can be clear color. That is completely normal. But if you notice discharge which is any other color, especially blood-stained nipple discharge, that is not normal. Please consult your physician. So like this is a repeat, a new lump in the breast or in the armpit, any changes in the nipple, any obvious change in the breast shape and size. Not both breasts are always same in shape and same in size, okay? One breast can be big and one breast can be smaller, that's completely fine. But if you have noticed any change in the shape or size that is new and drastic, please, that is not normal, consult your physician. Any changes in the skin, breast, nipple, areola, puckering, redness of the skin, scaliness, eczematous patches, eczema, itchiness. Okay, this is all not normal. These are the signs that you need to look for. So how you will know that something is going on? You need to be breast aware, okay? A lot of people think that how we can do it. It's simple. It's very simple. Just feel your breast. Not every time, don't get paranoid about that. Just once a month with the beginning of your period, that's the ideal time when your breast is softer because the hormone levels are down. Your breast is softer because just before the period, 1 week, 10 days before your period, you might have your breast sore, tender, swollen. That's completely normal, and that's not the ideal time to feel your breast because it's hormonal changes that are happening in this breast. So once your period is started, day 1, day 2 of the cycle, just start feeling for your breast with the palm of your hand. So these are the steps that you can look for. Stand in front of the mirror. Look for any shape changes, anything obvious that you can see. Check your underarms. Feel for anything. If you notice any lump, if you notice any nipple discharge, if you notice any changes in the skin. Raise your arms above the shoulders, above your head, and feel for any shape changes. If by raising your hands, if you notice any shape changes in your breast, not normal. You can lie flat with one arm under your head and feel the other from the other hand. Feel both the breast and never forget the armpits. You can perform these circular movements from up to down, from in the circular movements as well. Anyways, any type of movement is fine. Just feel it. Okay. And like I said, when to do it? Every month. Menstruating women after their period starts. Menopausal women, same day of the month. Pregnant women, same day of the month. And the whole breast and the armpits, and it should not take more than 10 minutes. So please be breast aware. All right, so these are the common common lumps that you can still have. Not always a lump in a breast is a cancer. That's also another common conception of women, that okay, if there is a lump, it has to be a cancer. There is anything in the lump, okay, it's nothing but a cancer. No, there can be many different things that can happen in the breast. There can be many non-cancerous things that can also happen in the breast. There are benign lumps which are not cancerous. There are benign cysts that are not cancerous. But you will only know it. You're not the expert. You will not know it, that whether it's normal or it's not normal. So don't consider that, okay, this looks fine. I have nothing. I have this for ages. No, just get an expert opinion. All right, so women of between 20 to 39 years of age, breast self-examination every month, and they can perform a self-examination, and if they notice anything, they can consult a doctor. They can perform ultrasounds in the breast, because benign lumps can happen even at the age of 15 and 16. Women at the age of 40 to 69, yearly mammograms, and depending on the density of the breast, we do also recommend ultrasound examination as well. And if the woman is above 70, yes, breast self-examination. If they are otherwise fit and healthy, they should continue doing their mammograms. All right, so yes, genetics is involved somehow in 5 to 10% of all the breast cancers. If you have a genetic mutation, if you have a breast cancer gene, which is commonly called as BRCA gene, the lifetime chance of having breast cancer can go as high as 80 to 90%. Not only breast cancer is associated with these type of genes, there can be other cancers as well. That includes ovarian cancer, that includes male breast cancers, pancreatic and prostate cancers. So we have a certain criteria that who to be called as a high risk patient and who is at a normal population risk. So generally we say 1 in 8 women will get breast cancer. That makes a percentage of roughly around 20%. So anyone who is above 20%, it will be considered as a high risk. So there are calculators that we use, and we put in details if somebody have a family history, if somebody have a previous lesion that was biopsied as a high-risk lesion, if you have a late pregnancy, if you have an early menarche, if you are overweight. We put these details in our calculators, and we come up with a percentage. If somebody falls above 20%, we do recommend high-risk screening. What is a high-risk screening? A high-risk screening is something that we generally start 10 years ahead of time. So instead of 40, these women will start checking their breasts at the age of 30. And we also add MRI for the breasts for these patients. So this is one of the family's history, which was having a BRCA mutation. So we can see that quite obviously not everyone in the family will get a cancer, even if you have a genetic mutation. Okay, but yes, definitely their chances are much more than the normal population. Breast cancer ideally should be treated in a breast center where you have all the facilities available. You need surgery, you need modern equipment, you need all sort of investigations, the latest machinery for diagnosing, for performing all sort of biopsies, and oncoplastic techniques, chemotherapy, radiation, because breast cancer will need all these. So like I said, a breast surgeon, a breast radiologist, you need a pathologist because you have to perform a biopsy, then this has to be reviewed by the pathologist. Oncologist, including medical oncologist and radiation oncologist, because medical oncologist is the one who will be taking care of the chemotherapy, and the radiation oncologist is the one who will be taking care of the radiation therapy. Nursing staff, everyone should be aware about breast cancer. They should be highly trained and skilled about how to treat with and deal with breast cancer patients, because whenever a woman is diagnosed with breast cancer, it's a lot of psychological and emotional trauma for these patients. So they need a psychologist, they need a lot of other support as well. Genetic counselor to just discuss about the genetic testing and how to look forward if they have a genetic mutation, what are the other organs that needs to be checked and screened for. Plastic surgeons, oncoplastic surgeons to reconstruct the breast and to perform the surgery in a best cosmetic manner. Nuclear medicine to perform the PET scans. Physiotherapy after the surgery is very important to prevent the lymphedema. When we remove the lymph nodes from the breast and the armpit, there's a chance that these patients can get lymphedema and their arm can get sore. So physiotherapy after any breast cancer surgery is extremely important. Complementary medicine includes pain medications and psychotherapy, anesthesia as well. Interdisciplinary team. So breast cancer is not only treated by a breast surgeon. You need a whole team. Early diagnosis, short diagnostic interval, early setup for diagnostic steps. So a lot of different specialities are involved in treatment of breast cancer to avoid unnecessary procedures, to avoid unnecessary biopsies. We do see a lot of time patients are advised to do biopsies and to remove unnecessary benign lumps. So this is not the practice that one should offer for breast. So the whole idea behind having a proper team involving different specialities is to do a better and the best prognostic survival in terms of breast cancer and cosmetic results and the long-term survival of the patient. So triple assessment, how a cancer or how a patient with a breast lump should be dealt. So once the patient have a complaint of breast lump or anything in the breast, we perform triple assessment. So patient first comes to the clinic. We have to take a thorough and detailed history. We need to bring all the previous records of the patient if she has been doing so regular checkups, regular mammograms. So you need to evaluate and see whether anything is new or this was there. This is very important to know whether this lump is a cancerous lump or is a benign lump. Was it there? If a patient have a lump in her breast and it has been stable for over a period of years and years, okay, we know that this has been stable and it's not growing. So this is very important that whenever you see a patient, you ask the patients to bring her previous medical and imaging record. So after taking a complete history about the family history, about how the patient noticed this lump, since when she's noticed this lump, is there any procedures done in the breast? Because we do see a lot of time, it's very common that patients have done cosmetic procedures in their breast, whether this is a fat transfer, silicone injections or silicone implants. So this is important for us to know. Then after taking a detailed history, we perform a physical examination. We examine the patient's breast and we examine the patient's armpit. And then depending on the age of the patient and the finding on clinical examination, if the patient is above 40, we send the patients to breast radiology. They do a mammogram for this patient. If the patient is below 40 and they have dense breast, we perform ultrasound scans of the breast. If we are clinically suspicious on a patient below 40 and we think that the lump or anything in finding in the breast, they are highly suspicious, we can perform mammogram below 40 as well. There is no hard and fast rule. It depends on the physician's decision. If on the breast radiology imaging and the breast radiologists who are the expert of breast imaging, not the general radiologist, breast has its own subspecialty in radiology as well. So there are radiologists who are trained specially for breast. So they are able to detect early changes. So if the radiologist thinks that the patient needs a biopsy, okay, we perform a biopsy. In the breast, we do core needle biopsies, fine needle aspirations, or vacuum biopsies. MRI only is required in the breast if there is a strong family history for screening. If the patient is already diagnosed with breast cancer, yes, but there is no other significance of performing a breast MRI. So surgery, yes, patients with breast cancer will at some point of time need a breast surgery, whether before chemotherapy or after chemotherapy. It depends a lot on the type of cancer. It depends a lot on the stage on which the cancer is being presented. If the cancer is picked up at a stage 0 or stage 1 early cancer, small cancers, yes, we do operate them. These patients might never require any chemotherapy if the type of the tumor is hormonal and it has not spread out to any other places in the body. These patients might benefit by only doing surgery and radiation. They will never require chemotherapy. This is the benefit that patients get if they are diagnosed at an early stage screen detected cancers. So surgery can be breast conserving surgery. Yes, the earlier the cancer is picked up, the higher chances of breast conserving surgery. We can just remove the affected and the diseased area from the breast. We don't have to cut the whole breast out. Yes, if the patient is coming very late stage, advanced stage, big cancers, then of course it is not advisable that this woman can save this breast. So early detection, you see, it has impacts on a lot of factors, depends on the stage of the cancer. Yes, this is a very common question that also comes in a patient's mind with having breast cancer, that, okay, if I just remove a part of my breast, the chances of cancer coming back are higher. No. So breast conserving surgery is a type of surgery in which we just remove the cancer and not the whole breast. And we do that with oncoplastic techniques that the patient might not be able to feel any defect in the breast, because we are trained to nicely fill these defects with the surrounding breast tissue. So breast conserving surgery always needs radiation therapy. And breast conserving surgery together with radiation. On the other hand, if a patient takes mastectomy and radiation, the chances of cancer coming back are completely equal. So there is no added benefit if you talk about the cancer recurrence or the cancer coming back. We don't add any benefit by performing a mastectomy. Yes, there are certain cases in which mastectomy can be only advised if the cancer is widespread, if it is centrally placed cancer which cannot be just removed safely. Yes, we have to perform at some places with the mastectomies. Whenever we do operate for breast cancer, we also have to remove some lymph nodes as well from the armpit, just to make sure that the cancer is not spreading out already in the breast, in the other places. Because if the cancer from the breast will spread out to other places, first it is going to go and sit in the armpit, in the lymph nodes in the armpit. So we have to check them. Reconstructive surgery, if a patient needs a mastectomy, yes, we can offer her same time reconstruction. Some women chooses to have reconstruction later on once they are done with the treatment. Some women, they don't want to have a flat chest and they choose for immediate reconstruction. Some women does not want to have anything. They just want a flat chest, which is also fine. And there are certain prostheses that are available which the woman can easily place in their bra and does not have to have reconstruction at all. Implants are the most commonly used reconstructive materials. These are made of silicone, and at the time when we remove the breast, we leave the skin intact and we just go behind the skin. If you will see, this is a breast, and we just go behind the skin and we remove all the breast tissue. We leave the skin behind and we just replace it with a silicone implant. And this can be done immediately during the same operation. It can be also delayed if the patient wishes to get it done later on. Some women, they don't want a foreign body in their breast. They don't like to have a silicone material in their breast. So the other options would be to take a piece of muscle from either from the back of the shoulder or from the tummy. These are, of course, more complex operations when compared to a silicone implant, which is a simpler operation with less complications and less trauma. But yes, the other things can be performed. We take a piece of muscle from the back and from the tummy, and we put it under the breast skin. This is called autologous reconstruction or flap-based reconstruction. This can be done together in coordination with a plastic surgeon. So certain breast cancers will need some sort of medication, which is commonly known as chemotherapy. These are medications which have side effects. Yes, very common side effects are like hair fall, being weight loss, diarrhea, nausea, vomiting. Chemotherapy medications are hard on our body. But yes, we do support all our patients with a lot of other stuff. They can have a cooling cap, which can save their breast from save their hair from hair fall. We do support them with a lot of other medications to deal with the nausea and vomiting. Anti-hormonal treatment, certain cancers, certain breast cancer, which are hormone driven. So these patients will definitely need to cut down on their hormone supply, which is coming from their ovaries and from the peripheral fat. So we give them anti-hormonal treatment as well, which have a common side effects of being, if a patient is premenopausal or it's still in her fertile groups, she might be noticing symptoms of menopause, and she cannot get pregnant in that time because these are anti-hormonal treatments. Whenever we give endocrine treatment or anti-hormonal treatment, it affects on the bones, so we need to take care of the bones. We do give supplements to them, complementary medicine, supportive medicine. Breast is a very diverse field, and every day something new is happening, a new research, a new publication, new trial. So you have to be updated with the international guidelines and treat the patients according to the latest guidelines, because we get these guidelines every year and these guidelines change every year. Not dramatically, but yes, we do see a lot of development in breast cancer. Like I said, patients definitely, whenever a woman is being diagnosed with breast cancer, it's a lot of emotional and psychological trauma. And this patient needs support from the family, from the physician, from the nurses, from a lot of people around it. We have support groups for these type of patients where patients with the same type of problems, they sit together, they share their feelings, they share their experience, which is kind of a huge help and support for our patients. Counseling of the family members, especially the husbands and the boyfriends and the partners, these all people needs to be supportive. Still, unfortunately, we see a lot of cultural values that comes, oh, we cannot tell this to our family, we cannot do this. Women are scared, they need all the support from their family, otherwise it's very difficult for them. We do see that once the patient is being diagnosed with breast cancer, their husbands, they divorce them, their boyfriends, they will leave them. So it's an add-on emotional trauma for them. On the one hand, the woman is suffering and dealing with the breast cancer, and she needs all these support to deal with this, to fight with this. So we do provide support groups and psychological help. We have psychologists available who can deal with this. We have breast care nurses who try to talk to the patients and support them. So I think that's it. Thank you. If anyone have any questions, I'm happy to answer.
Dr. Hi, there were a lot of questions actually. So what I'll do is I'll consolidate few questions together. So the questions to start with is on what are the chances of women being nulliparous, or women who have never breastfed children to have breast cancer. It's a myth, I'm not sure if it is a myth, but largely people talk about that these females have a larger chances of getting breast cancer. So if you could explain something on that.
Okay, so coming to the first question, being nulliparous, yes, it is kind of considered as a risk factor if you get pregnant at a later age. If you never get pregnant, yes. Why? Because when a woman gets pregnant, when a woman goes through pregnancy, there's a lot of hormonal changes that happens in our body, and these hormonal changes influence our breast. Once the woman enters in the breastfeeding, there's a lot of lactational changes that also happens in the breast. These kind of changes the breast, involution happen in the breast, and this is kind of a protective way because you see when a woman is pregnant there is less exposure to the hormones. Yes, understandable. Coming to the breastfeeding, yes, we do recommend breastfeeding. It's healthy for the woman, it's healthy for the baby. But like I said during my presentation, that we cannot say that strictly that yes, if you have never breastfeed, oh, you are definitely going to have breast cancer. No, that's not at all. You should not be guilty about not being able to breastfeed. You see, I would see a lot of women who have multiple children, have breastfed half of their life, still gets breast cancer. Okay, and on the other hand, maybe a woman who have never breastfed will never get a breast cancer. So it's not the only criteria to say that, I would say. So no, don't feel guilty about that.
Doc, there is another question which is specific about the difference between taking conventional HRT
Mhm,
versus BHRT, the hormonal therapies,
mhm.
and versus bioidentical hormone therapy, and what are the implications it can have on risk factors on breast cancer?
All right. So, hormone replacement therapy, this is a topic which is still in a gray zone. There is no black or white when it comes to hormone replacement therapy, bioidentical agents, and all these new things. There is not much research has been done on these at the moment. Yes, they are new agents, bioidentical agents, and they claim that okay, they are completely safe. Like I said, anything exogenous synthetic hormones, definitely they impact our health. So this is a discussion that patient needs to do with their physician. Okay, if like I said, if the symptoms of menopause are so bad that it's impacting your life, you're not able to sleep because of night sweats, your bones are at risk, you're getting osteoporosis and you have to have it, take it, there is no harm. But yes, we need to see and we need to limit the duration of these hormone replacement therapy, regardless whatever type you're taking. All right. Yes, combined pills are slightly more affected because they have more estrogen components. But let's say if a patient of mine at the age of 35 develops a early menopause, okay, we do see that patients in her 35 developed a premature menopause. So this patient will by the end of 45 she will have a backbone fracture, because if she will not take these hormones, her bones are at risk. She might have a heart attack because estrogen not only is involved in our fertility, but also is involved in our bone health, in our cardiac risk. So this woman, I will tell her, okay, you need to take this hormone replacement therapy because it is, the benefits are much more than the risks of breast cancer in this particular woman. All right, I cannot endanger this patient to have a backbone fracture or have a heart attack just because of a slight increase in chances of breast cancer. No. So this patient can have it. Okay, yes, then of course she is at a higher risk. Okay, somehow we are increasing this risk by giving her hormone replacement therapy. family, okay, get your screening done more often than the others. Get your screening mammograms done at an early stage. Do your ultrasound scans. This is what you can do. Well, on the other hand, if a woman is already in her 50s, okay, and she is not yet ready to have been labeled as menopause, or she is still struggling with her mood swings or night sweats or anything, okay, this woman, I say, okay, maybe how many years you are going to take? 2 years, 3 years, 5 years maximum. Okay, this does not have a significant impact, I would say. You know.
Doc, next, a few of the questions are related to laser hair removal.
Okay.
Does it have any effect on breast cancer?
No, not that we have studied, not that any researchers have shown. Yes, what I commonly see is that when some, not all, some women who do laser hair removal in their armpit, they develop, when I'm sure you have seen when I was showing the slide in which we have lymph nodes in the armpit. So we do see that when they have done a session of the laser hair removal, their lymph nodes are slightly swollen. Okay, and when some of them they have felt and they came to us and we have done a scan and we do see that yes, they are slightly swollen. So generally, when normal lymph nodes in the armpit, no one is able to feel them because they are tiny. But when they get swollen. We are able to feel these lymph nodes. So we do see that it is related in some women with the laser hair removal. Also, recently with all these COVID vaccinations and boosters and all those things, majority of the people have done vaccinations in their left arm and they develop enlarged and swollen lymph nodes in the armpit, which was actually related to the vaccination. So any infection that can happen in your arms, which will ultimately drain in the lymph nodes in the armpit, can show and present as the swollen lymph nodes. But laser hair removal has no relation with breast cancer.
Doc, it is a very personal question which says that I have a very strong family history, yet every year do I need to get mammogram every year or 6 months? What is the frequency?
Okay. So if somebody have a very strong family history, with very strong family history, I believe that a mother is involved, either a mother or a sister, or at least two aunties or two grandmothers. Okay, that is considered as a strong family history. If there are certain added factors, okay. Yes, if you are above 40, you need to perform mammograms every year. You can perform ultrasound scans every 6 months. If someone have a genetic mutation, any gene is involved, you need to perform MRIs every year as well. So the three together, mammogram, ultrasound scan, and MRI for a very high risk patient. So how we do it? We perform, and also not only these imaging, they need to be seen by the specialist every 6 months to perform a clinical examination. So how we try to schedule that, if we have a patient who is a very high risk, we perform, let's say January, she will come. Okay, we do examination, we perform a mammogram. Then I tell her, okay, come back in 6 months. July she will come, I perform a physical examination and I do an MRI this time. Then again next year, January she will come, it's already time for her mammogram. So I try to schedule it every 6 monthly, alternately with mammograms and MRI. But I believe not everyone will need MRI unless it's a very high risk. Generally, mammograms and ultrasounds are more than enough.
Doc, during your session, you mentioned something about the fatty tissues. People who lack fatty tissue, there is a chance. Can you just help us understand about that?
Okay, so the fatty tissue is like, okay, breast basically is made up of two different type of breast tissues, okay? Two different type of tissues. A little bit content of fat. So after the skin, there comes a layer of fat, then comes the breast tissue. The more breast tissue you have, the denser your breast is, okay? And dense breast is increased chance of breast cancer, however, the fatty breast has less chances of breast cancer. It's that. Fatty
So
breast,
basically it is,
yes, so
sorry, doc, you were telling something.
fatty breasts are softer breasts, are easy to feel as well. Denser breast everywhere feels lumpy and nodular, and they are difficult to be felt as well. Dense breasts are also not perfectly seen on mammogram. So dense breasts do most of the time does require ultrasound scan, and we do see that very common because now with screening in the month of October and awareness, a lot of facilities will perform screening mammograms. So very common it's seen that reporting is incomplete because if a woman having a dense breast, she doesn't require only mammogram, she requires ultrasound as well. So mammogram might not be able to see anything in a dense breast, so she needs ultrasound scan as well.
What are the chances of breast cancer for young women, including teenagers?
So if there is a genetic mutation like BRCA mutation or any other gene involved, we do start screening them from the age of 25. Below 25, it's extremely rare. But yes, with if let's say somebody who have a mutation of BRCA, the common age that we see is early 30s.
Doc, can you shed some light on the metastatic breast cancer along with what are the latest and the most effective treatments available?
Okay, so metastatic breast cancer is considered as stage 4, which is a very unfortunate situation for the patient and for the physician that, okay, this is the last stage, then we cannot offer a lot to this patient. Now, it depends that how many places the cancer has already metastasized and already is sitting in the body. If a woman is diagnosed with the metastatic breast cancer, there is very limited options that we can offer. We cannot treat this patient with a curative intent. However, in a stage 0, stage 1, and even stage 2, we do treat the woman with a curative intent that we can completely cure of the disease. But in stage 4, it's the last stage. It is difficult to say that once a woman is diagnosed with stage 4, how many time does she has left? No, we cannot say that because every patient varies and every cancer is different. There are some aggressive cancers which we see that, okay, there are certain patients who have been diagnosed years ago with stage 4 and they are still okay, but yes, they will need to continue with some sort of medication lifelong.
Doc, is there any food items or things which should be avoided or you think that it can prevent breast cancer or any type of cancer per se?
Okay, so for any type of cancer, I would say that being physically active, any type of exercise program, maintaining an ideal body weight, having a healthy diet, at least 3 or 4 different type of fruits and vegetables daily in your routine is what you need. Okay, being overweight, unhealthy diet, rich in saturated fats, smoking, alcohol, these are all those things, those factors that have impact on a lot of cancers, not only breast cancers. Then you see, like I said, if I have 10 patients of breast cancer, out of 10, in 8 women, I have no reason rather than just they are being female and they have breast. So what we can do when we don't know the exact cause of these things, we can at least make an effort and play our role to pick up these things at an early stage where it is a huge, huge, huge difference, you know. If it is screen detected, we can offer you a complete cure. While if it is a stage 4, then of course a lot of things we cannot even offer you a complete cure. So yes, physically active, ideal body weight, no smoking, no alcohol, healthy diet, fruits, vegetables does not mean that you cannot have chocolates. You can have chocolates.
Doc, docs, there is a question that if one is not able to examine herself, can a doctor support on examining without
Definitely.
a mammogram? Yes.
Definitely.
So I think it
Definitely.
is part of the consultation when it
Yes,
comes
yes,
in.
yes. Like I said, when a patient comes in the clinic, we take a detailed history, then we do a complete thorough examination, and then depends on the findings, we do offer them. If they have nothing in the breast on examination and they are below 40, okay, we might not need to do anything, but they are above 40 and we don't feel anything, we will still do recommend a mammogram, because there are certain things, there are certain findings on the mammograms which we are not able to see. So which we are not able to feel on examination, and they are only being picked on the mammograms and x-rays. So yes.
Okay, so Doc, there are several questions, which is ultimate investigation to find out of breast cancer? Is it mammogram or ultrasound? Because
Mammogram.
there is mammogram, because
Yes.
it seems there is one of the member who is 43-year-old, do not have a kids, and her breast was very fat. So initially a mammogram was done, which was said not to be enough, and ultrasound was asked. And similar is the question that asking ultrasound can tell if there is any symptom, or mammogram is must to find.
So, like if it's a fatty breast, ultrasound scan is more than enough. Sorry. If it's a fatty breast, mammogram is more than enough. If it's a dense breast, mammogram is not enough. This does not mean that you don't need mammogram. You need mammogram together with ultrasound scan in a dense breast. In a fatty breast, above 40, above 50, mammograms are enough.
Okay, understood, Doc. Do you suggest performing genetic test as my close aunt has cancer in order to know the chances of cancer or not, how accurate it will be? So it's, I think, genetic testing, BRCA1 and BRCA2, right?
Yes, so genetic testing does not only involve BRCA genes, there are other genes as well that are associated with breast cancers. Yes, most commonly is the BRCA gene, okay, which has 80 to 90% chances of giving breast cancer. Having one aunt, it depends on what age this aunt have. So any family member or any relative, let's say a sister or a mother who was diagnosed with breast cancer at an early age, let's say 35, 40, 41, 42, okay, this is this can be related to genetic mutation. Okay, so yes, if you have multiple family members all diagnosed with breast cancer at a young age, do perform a genetic testing. Now I always tell my patients, okay, getting a genetic test done is completely simple. It's a blood test. Okay, 2 weeks later you will get the results. Now what? Do you still want to do some further things? If somebody will have a genetic mutation, okay, fine, we know that. We can talk about risk reducing surgeries. But if somebody still have a family history but no genetic mutation, they will still have to do a high risk screening. That means every 6 monthly seen by the physician, every year mammograms and MRIs, you know. So genetic test is something that is a simple test, but the consequences, then how you want to deal with the results, that is important. So I would say that, okay, if one aunt having a breast cancer, okay, do nothing, just get your screening done regularly and that's it.
Doc, I think from today's session, what we understand, and that is the entire objective of doing the October breast cancer is screen ourselves, not
Yes.
to wait until the symptom comes. Doc, so that is a question which comes like, what would be the right age for a female to start screening every year?
Okay, so screening is something that you don't feel anything in your breast and you have to check your breast. This is called screening when you notice nothing. Okay, that starts from the age of 40. But if you have any complaint in your breast, and how you will find that? You have to self-examine yourself, okay? Like I said, every month, feel for anything. And if you've noticed anything, you should not wait till you get 40. You just come straight away because changes can happen early. Now it's the incidence of breast cancer is increasing, that we do see a lot of 35, 34, 36, this age group also coming up with the problem. So don't wait. It does not mean that you need to start screening mammograms. No. If you have a symptom in your breast, if you have a complaint in your breast, you have to see the physician. But if you have no complaint in the breast, then from the age of 40, of course.